Thank you very much, Presiding Officer. I've been very supportive from the outset in relation to the integration agenda, having, before becoming a member of this Parliament, having served on the Social Care and Wellbeing Committee at Aberdeen City Council, and seeing for myself some of the challenges that were faced in terms of the delivery of social care. It's worth noting that while I was a member of Aberdeen City Council, we managed to get the delayed discharge figures down to 0 in the city of Aberdeen. Unfortunately, since we left the administration, that figure has slowly crept back up to a higher level. And I think one of the difficulties that has been faced, and one of the reasons why that has occurred, has been a difficulty in ensuring that appropriate care packages are being put in place for individuals coming out of an acute setting. And it's one of the issues that I have seen on a number of constituency cases in terms of individuals who have often been taken from an acute setting and placed into a care home setting rather than being allowed to return home, because the care package to allow them to return home cannot be put in place. And that has persisted even with the decision by Aberdeen City Council, a decision I did not agree with, to outsource their social care to an arm's-length organisation, Bon Accord Care, rather than having it being delivered on an in-house basis. But I believe that the reason why I was supportive around the health and social care integration was around the tackling and the removal of the silo mentality that often existed between health and social care, and the gaps that could often arise into which individuals could find themselves falling. And an opportunity to create that more joined-up approach, I felt, was something that should be pursued. It's something I still think is going to turn out, when the integration joint boards take effect, is going to prove to be of benefit to all of our constituents. But I think there are other areas which we need to look at tackling as well, beyond the silos that existed between health and between social care. And those are silos that exist within specific areas themselves. There are silos that exist within the health service between primary and acute services that I think still do need to be addressed and need to be brought much closer together in terms of the way that they work. And that would, I think, help in terms of some of the issues that were raised before about individuals finding themselves in an acute setting, which is obviously more expensive than perhaps being dealt with through the primary care sector. But even within the primary care sector itself, making sure that all of the different professions within the primary care sector are working in a much more rounded and holistic manner to ensure that, for example, and I know we'll be talking next week in the scheduled debate around primary care redesign, but to ensure that when an individual presents in a primary care setting, they present to the most appropriate professional at that time. That, I think, again, would relieve workload pressures and create the system that allows people to be seen in the most appropriate setting and to be dealt with in the most appropriate setting. Now, I have a huge amount of respect and value for the work that is done by carers, not least because my mother, when she was working, was a carer, and both in terms of being employed as a carer, but then also laterally was an unpaid carer after that. So I recognise entirely and understand if I could just develop the point, recognise entirely the strain that is often placed upon individuals in that environment. I think there are a couple of things, though. The first is that in terms of the call for care workers to be paid a living wage, of course, as the Cabinet Secretary pointed out, those who are paid through the public sector already receive the living wage. But beyond that, the ability to effect a living wage for those who are employed out with the public sector environment would have been immeasurably increased had the opportunity been given through the Scotland Bill, as the STUC called for powers over employment legislation and employment rights to come to this Parliament. But the other thing which would help, and one thing which perhaps we should be encouraging the integration joint boards to look more closely at, is a move away from unit cost purchasing when it comes to social care services, and looking more widely at an outcomes-based approach rather than the simple unit cost approach. That, I think, would perhaps allow for a greater flexibility in terms of the pay and conditions that are afforded to care workers. I realise I said to Jenny Mann I would take an intervention from her if she's still wishing to. No, she doesn't on that. But I think what's very clear Presiding Officer, is that there are difficulties being faced in the care sector in certain areas. In my own area of Aberdeen, there is a real difficulty around recruitment and retention. It was highlighted to me when I held a care sector jobs fair in my constituency aimed at promoting opportunities within the care sector. Now, I know from feedback that I've had from organisations that individuals were able to secure positions as a result of that jobs fair. But it was noticeable that compared to a previous jobs fair I'd hosted, which was much more wide-ranging, a drop in terms of the footfall, because individuals do not necessarily see the care sector as an area they wish to go. And part of that will undoubtedly be around the pay element, but part of it is also down to, I think, a perception of what the role entails. And what we need to ensure that we're doing, I think, to help tackle some of that, is to present a much more positive image of the work that is done in the care sector and have more people speaking up for the valuable role that is performed by those who work in the care sector. I think that would be helpful in attracting more people into that role. And just finally, Presiding Officer, if I may, one of the things that seems quite clear this afternoon is that we have a very conflicting message coming from opposition parties around where the health consequentials should be allocated. I think I have no understanding or knowledge of where the health consequentials are going to go. It sits above my pay grade. But what I do know is that the Cabinet Secretary and the Deputy First Minister will entirely be focused on making sure that the health consequentials are spent in a way that benefits the people of Scotland. And that, for me, is the most important element in all of this.